So the last part of this Learning Plan 12 now is on natural and man-made disasters, and of course focusing on certainly overall aspects of this, but also the nursing role. So we're looking at Chapter 29. So some definitions of disaster. It is any event, so could really be so many different things, that causes a level of destruction, death, or injury that affects the abilities of the community to respond to the incident using available resources. So that's kind of the key phrase and why I kind of highlighted that in blue, because a disaster usually means that it is something that is beyond. When the definition says it affects the abilities, usually what that really means is that it is beyond the capabilities of that community to respond. They have to look outside of their own community in order to help. They just don't have all of the resources within that community to help efficiently and effectively in that disaster. So further definitions, a mass casualty involves 100 or more individuals, and a multiple casualty involves more than one, so at least two, but up to 99 individuals. So that would be a multiple casualty. So think about if there's a car accident on the highway and there are several cars involved, perhaps 3 or 4, maybe it's a pileup, and there could be 10 or more people that are involved. So that would be a multiple versus a mass casualty, which we would think about, a fire in a facility where a lot of people couldn't get out or had trouble getting out, an airplane crash, so something that involves a larger amount of people. Certainly could be tornado, could be hurricane, things like that. So casualties are classified as either a direct victim, an indirect victim, somebody who is displaced, or a refugee. Of course, the direct victim is the person who is immediately involved. The indirect victim could be a friend, a family member, or even possibly a first responder. A displaced person, usually we think about that as somebody who had to evacuate as a result of something happening. And then, of course, a refugee is refugees are groups of people who have fled their homes or even their country because of famine, drought, natural disaster, war, or other types of civil unrest. So types of disasters. Natural disasters includes weather events, earthquakes, volcanoes, other types of diseases could cause a natural disaster, especially if it's a huge outbreak. Man-made disasters, wars, structural collapses, accidents, riots, pollution, terrorism may include weapons of mass destruction. And combination disasters could be natural and technological disaster. So that could create a widespread technological problem. So in other words, that would severely impact communication, and that level of destruction of communication, of course, would make it very difficult to respond to that event. So again, some examples of natural disasters: avalanches, blizzards, communicable disease epidemics, droughts, wildfires, earthquakes, tsunamis, hailstorms, heat waves, hurricanes, tornadoes, cyclones, volcanic eruptions. So I'm sure that's not all inclusive, but looking at the list, we always have to think about what are the areas that I have to worry about where I live. So I will never have to worry about a volcanic eruption unless, of course, I visit a place that has an active volcano. And I did once look down into an active volcano that was bubbling and churning, and red magma just boiling in the core of the earth. So I know what that's like, but I wasn't there. It was when I was in Nicaragua a few years ago, and they didn't let us stay very long. They kind of herded us back onto the bus and out of there pretty quickly, just in the event that something should happen. But surely there are things that I don't really have to worry about. Heat waves, I kind of laugh at that one. In Wisconsin, a heat wave? Well, we would probably think about upper 90s and low 100s. I'm sure that it's gotten to be 100 degrees here every now and then, but I don't really remember that all too well, I guess. I think for us, maybe worrying more about, we certainly can have hailstorms, blizzards, not avalanches perhaps, but blizzards, severely cold weather that could cause some type of a of a disaster. So again, look at our, tornadoes. Yeah, we can have tornadoes in our area. So we have to look at our area and think about as nurses, which of these issues is a possibility in my community? Man-made disasters, terrorism, civil unrest, explosions, bombings, again, fires, structural collapses, and that would be fires that would be arson, not a fire that would occur naturally. Structural collapses, bridges, airplane crashes, toxic or hazardous spills, mass transit accidents, so it could be a train, several buses, a huge accident on the highway in which perhaps multiple vehicles are involved, pollution, and wars are all considered man-made disasters. So looking at this picture, how would you feel if you were on the wing of that airplane right now? Yikes. So as nurses, we're always thinking about what are the possible effects, psychological and physical effects of disasters. So some other characteristics, we have to think about the frequency. How often would that occur? I was just in Grenada a few months ago, and it was interesting because they were very concerned because it was upcoming hurricane season, and they hadn't really had a hurricane for quite a while, but they were, I think every year when it's hurricane season, they are always very worried, thinking back to the destruction and devastation on that tiny little Caribbean island, and worrying that that may happen again. So how often does that occur? Is it something that is likely to occur on a frequent basis, or is it something that is going to be, once in a blue moon? So the predictability, the ability to determine when and whether a disaster will occur. So is it predictable based on different, I'm certainly not a meteorological expert, but some people really have a good understanding of that. They understand weather patterns, and they can kind of predict maybe when something is going to happen. Mitigation actions taken to reduce loss of life and property. So that would be the things that are usually, if we take action before the disaster happens, then usually you can help to reduce that loss of life and property. That might even include encouraging people to evacuate. And I know that sometimes there are certain areas in which perhaps a hurricane is coming and people just choose to stay in their homes and ride it out, and maybe they feel like they've been through one before, they can do it again. But honestly, that just makes it very difficult, because if they are needing to be rescued, then they're putting rescuers in danger because they chose not to evacuate. So that can really create some, very difficult situations. So it's always good to try to take action before something happens. And truly, if there is an evacuation, people need to take that seriously. We also, as nurses, have to think about people that might have difficulty evacuating, such as people that are handicapped or elderly that may need some special assistance in order to be able to, to do that safely. So the imminence is the speed of the onset and anticipated duration of the incident. So is it coming right now? Is it going to be a few hours from now? Do I have time to prepare? Whenever we have a tornado watch, so that means the conditions are right for a tornado, and then we may have a warning because somebody has spotted that funnel cloud. So we have to think about, okay, is it something that, even if when it's at that first stage of a watch, people should be taking that seriously, taking shelter, and doing appropriate things to try to safeguard first of all their lives, and maybe also their property. So the scope of the disaster is something else we have to think about, the range of the effects of the disaster. So is it a very small range, or is it a far range? Like in this picture, it looks like it's something that's going to affect, because of those huge black clouds and the amount of fire and probably the difficulty with putting that out. Fires certainly spread, and is this going to continue to spread into surrounding areas? And certainly the black smoke is going to carry for miles. So what is the range of the effects of the disaster? The number of casualties and the intensity, so the level of destruction and devastation. Apparently in Grenada, however many years ago it was when they had their last hurricane, it sounds like it really caused a great deal of devastation and really needed they needed a lot of time and resources in order to rebuild. Homes were destroyed, places of business were destroyed. And if you're in a small island, it's actually an island about the size of combined Sheboygan and Manitowoc populations, about 110,000 or so people. So really a small place. And when you have a small place like that, there may not be a lot of resources. So what is the level? Is everything flattened, or is there just a little bit of damage that can easily be rebuilt? So things to consider. So natural and man-made disasters. So the health of a community is affected by disasters. So of course, that's why we as nurses are worried about these issues. There are programs created to address disasters on the national, state, and local level. So that is also part of the competency, is to think about that this is not something that a nurse is going to handle, or group of nurses is going to handle on their own. It is definitely an interdisciplinary collaborative effort, and there are community resources that are very specific to help handle emergencies. So there is a national incident management system, and that provides a systematic way for the government and non-government agencies to work seamlessly to prevent, protect against, respond to, and recover from the effects of disasters. So disaster management stages. So the prevention, preparedness and planning, response, and recovery stages. So prevention in disasters. So non-disaster activities. So in other words, there's nothing going on, but you just always want to be prepared and think ahead of time. So of course, following the nursing process, we're always assessing first. So we're assessing our communities to determine potential disaster hazards. Now, in Two Rivers, there is a nuclear power plant. So one would think that could be a potential for a disaster to happen. And I just looked it up quick, and I'm not seeing anything online as far as any kind of actual events, but it sounds like over the years that they have had some problems with equipment that have had to be resolved so that a disaster wouldn't happen. So assessing the community, see what's on in your particular community that could cause a potential disaster, whether it's where it's located, and again, if we're prone to tornadoes, hurricanes, if the community is located near a volcano, whatever, assessing that community. So, and then developing a disaster plan at the local, state, and federal levels. So there are community health nurses, public health nurses, that are actually, their job is to develop a disaster plan from the nursing level at the level of the public health department. So that is an ongoing process. Conducting drills to test the plan. So last spring of 19, I was very lucky to be able to have a couple of students and myself attend a disaster drill in the parking lot at Sheboygan Memorial. And we did that, and it was just right around the time of post-conference. So instead of sitting around and talking and having post-conference, we went outside to view the disaster drill. It was very interesting. They were kind of doing a mock helicopter crash in the back parking lot of the hospital. And the part about it that was interesting was watching what was going on and watching the various levels of communication, who was involved. So first responders came, fire departments came, and sometimes we noticed as students and myself watching, we actually noticed a couple of communication glitches that were happening. Like some first responders were had a fake victim, and they were wheeling that person into the hospital, attempting to bring them to our emergency department, when all of a sudden somebody with a radio kind of was like, no, you're supposed to take them to St. Nick's. Oh dear. So it was interesting watching. So, and as a result of that drill, they definitely learned a lot of very good information in case a disaster actually were to happen. And I know most of the issues that came up with were related to communication. So one of the biggest problems that the person in charge talked to us afterwards, one of the biggest problems was actually that there was no way for the hospital staff to directly communicate with the helicopter pilot. So it had to go through another route. They had to call somebody else who had to call the pilot. So just even breaking down communication barriers like that can really be very helpful in the event that it was a real disaster. So disaster drills are great. Hopefully someday you'll get a chance to observe or perhaps even to participate in one. I know they have some at LTC every now and then too. Training volunteers and healthcare providers to be able to respond to a disaster would be very helpful. So again, during a drill, people understand what their role is and what they can do. Providing educational programs and developing risk maps and resource maps. So again, if you map out what risk factors are in a particular area, and then a resource map as to what are your resources in that area, and just really have that kind of mapped out ahead of time can be very helpful. So pre-disaster activities include notifying the appropriate officials, warning the population, advising what response to take, and that could include, again, voluntary or mandatory evacuation. So that is really at the step where something is happening, something is coming, we have to do something. We have had, I think it was last week, that we had several text messages from LTC talking about a tornado warning. I just checked my cell phone. I just wanted to see when those text messages were occurring, and it looks like there was a couple of different days in July where we were warned about a possible tornado coming. So always good to have different systems like that in place because it reaches so many people. So the preparedness and planning stage, so individual and family preparedness, it is helpful to encourage people to get some training in first aid. Of course, as a nurse, you may not necessarily have this specific training. However, by virtue of your nursing career and education, you certainly will know basic first aid measures. It's just a good thing to encourage other family members and other people in the community to get that training. Assembling a disaster or emergency kit. That is an incredibly helpful thing for anybody to do. Every family should have one, and actually every nurse should truly carry an emergency kit in their car at all times. So what are some things that might be helpful to have in an emergency kit? The top of page 597, there is a green table, and it basically talks about different things that are recommendations for a basic disaster supply kit. Now, you might not want to have all of these, especially in your car, but honestly, it is a good idea to at least have some of these. Water, batteries, a first aid kit for sure, and some types of sanitation and hygiene items like moist towelettes, or even possibly, well, it says toilet paper too, but sanitary wipes or just some kind of gel too, hand gel, matches, waterproof container, a whistle. That's not something I would have thought about. Just having extra clothing on hand. And if you live in different types of, like we do, we live in an area that has different types of weather, so having warm clothes on hand, but also having cooler clothes on hand might be a good idea. So extra clothing, cash is always helpful. A coat or a jacket, sturdy shoes, sleeping bag, or at least like a blanket is also a very helpful thing. So just some things to think about and to encourage people to have. When we're working with families, talking to them about having a predetermined meeting place away from home. So in other words, especially if it is something like a fire that might happen in your home. So the meeting place should be perhaps a trusted neighbor, or if there is a a store that's open 24 hours that's close by that everybody can get to safely. So just having some kind of a predetermined meeting place so that you can account for all family members. Just having a family communication plan. So who's in charge? How do you communicate? Just the logistics of all that, evacuation and rescue. It's actually just really quite a good thing that so many people have cell phones these days, and even some children do. I don't know what the youngest age is these days of children having cell phones, but that really makes life so much easier. So when I was growing up, I never would have thought in a million years that there would be such a thing as a phone that I could carry around in my purse and use anywhere I went. Phones were in your home, or there were things called phone booths. Have you ever seen a phone booth? I would be willing to bet that most of you probably have seen them maybe in pictures in history books. Well, anyways, so that to me, that aspect really does help, unless you have a communication, some kind of an outage with your cell phone server. Honestly, that would certainly be able to make communication quite a bit easier and make sure everybody is getting to a safe place. So again, part of that preparedness planning stage is the community disaster planning. Plans must include, again, who is in charge in that community, and again, the communication. So I just think about the helicopter helicopter crash that was staged at Sheboygan Memorial, and just thinking about there definitely was somebody in charge, but what a job that is too, to be monitoring everything that's going on at one point in time. So, and proudly, that nurse is an LTC graduate of a few years ago. So we also have to think about that logistical coordination of supplies and equipment, human resources, evacuation, and rescue. So plans have to be dynamic and change as needed, and plans, again, have to be tested in different types of disaster scenario drills. The response stage begins immediately after the disaster incident occurs, may include shelter in place, evacuation, search and rescue, having a staging area, and disaster triage, which really means it's very kind of a sad and difficult concept, but the greatest good for the greatest number in the shortest amount of time. On page 602, at the top, there's a purple table, and it's called Shelter in Place Instructions. So it's actually quite nice. It goes through if people are at home, at the daycare center or school, work, or in their vehicle, what exact instructions are given to shelter in place, such as at home, bring children and pets indoors, close and lock your doors and windows, turn down the blinds, turn off fans, things like that. At work, close the office or business, making customers, clients, or visitors in the building aware they need to stay. So everybody needs to shelter in place. Close, lock all windows, exterior doors, things like that. Vehicle, if close to home, workplace, or a public building, go there immediately and go inside. If unable to get indoors quickly, stay in your vehicle, because that might be the safest place possible. Stop under a bridge or in a shady spot to avoid getting overheated. So it gives you some very nice tips on shelter in place. Evacuation, kind of talked about that already. Basically, if it's a mandatory evacuation, there are times then when hospitals or nursing homes have to also think about evacuating their patients or residents. Yikes, that would be extremely difficult. Think of the people in the intensive care unit that are hooked up to many different life-saving machines. So, wow, and oxygen, things like that. That would certainly be a very difficult undertaking. And also, again, to think about that aspect of some people that just won't evacuate, and just trying to really, as nurses, just really stress to people that if it's either recommended or required, that it really is to save their life. Some people are just very stubborn. They don't want to leave. They're afraid of vandalism. They don't want to leave their possessions. But again, reinforcing that, of course, human life is more important than possessions. So that can be a difficult thing. So search and rescue, of course, safety has to be
highly considered. Maybe law enforcement might even have to be the first to respond to secure the area, especially if you're suspecting criminal activity. And then once the particular area is cleared of potential threats, then a staging area can be set up. And I'll show you a diagram of that in a little bit. So that staging area is basically the on-site command station. So that's where everybody should check in. People who are involved in the disaster, they check in, they're accounted for, and given assignments. Really important to mention is that nobody should go into the disaster site unless directed to do so by the staging area commander. So that person is in charge and they really need to monitor what's going on. Disaster triage, I'm going to talk about that also in this next slide. So basically there is a color code, and I looked in another site elsewhere and they also talk about a white code, a white level, which means basically that the person doesn't need any resources at all, and I don't think that's mentioned in your book. So black, unfortunately, is the person is either already deceased or their injuries are so extensive that they will not be able to survive given the care available. So again, we're thinking about emergency care that's happening out in the field, not necessarily in an emergency room or in an intensive care unit. Perhaps the hospitals are flooded with patients right now. They need to be giving care to the most critical patient first, and you might think, well, this person is the most critical, but unfortunately in this type of a setup, you really have to think about, again, helping the most people, doing the most good for the most people, given the available resources. So because the resources are limited, if they are coded black, that means that they will not be giving them care. So they wouldn't be able to survive given the care available. Red is the top priority. They cannot survive without immediate treatment, but they have a chance of survival. So that's the basic difference between red and black. With black, they're really saying they don't have a chance of survival. With red, they do have a chance of survival, but they need immediate medical care. Yellow, they have some systemic complications. They're not in immediate danger of death, but they do need hospital care. So they can wait a little bit. You know, they're not in immediate danger. Green, the walking wounded, who will need medical care at some point, and they can wait several hours. So they're going to need, they do have some injuries, they're going to need some care, but they can actually wait. So that is how people are triaged in a disaster in order, again, to maximize the saving of as many lives as possible. So this is the same picture is in your book on page 603. So there is the initial triage and rescue area, the staging command area, which as you can see is kind of far away from the actual event that happened, and then the treatment and transportation evacuation area kind of in the middle. And in that middle section is where they would be doing that triage and putting people into the black, red, yellow, or green categories. So responses to disasters, of course, again, I have to throw in the psychological. We have to think about the effect of a disaster, not only on a person physically, but mentally. So 4 phases, the heroic phase where they're helping others and they kind of feel really good about getting out there and doing what you can. It's kind of that adrenaline rush that you might get from that type of experience. And then the honeymoon phase, they relive the event, they tell stories, express gratitude, but then disillusionment kind of sets in because reality is really hitting. They may feel despair and exhaustion and really feel the full impact of that disaster mentally quite a bit later. And the reconstruction phase, it's kind of like, okay, this is what we have. You rebuild, you return back to normalcy. So it definitely is a stage when you respond to a disaster. I don't know if any of you have ever have been in a disaster or part of that. I guess the flood of 98 is something that we had in Sheboygan that perhaps some people would consider a disaster. It certainly was. Many people lost a lot of possessions. Their homes were flooded. Their basements were flooded. They lost cars. They lost, they had severe property damage. It certainly was a disaster in our community. And I personally was very lucky that we didn't have that type of flooding or loss of our possessions, but I know a lot of people that did. And it really was a very, very difficult thing. It took them a long time to recover from. So just think about other types of disasters, like if your whole area is flattened by a tornado, just the steps that you would go through in order to recover from something like that. We also have to think about that a common reaction to a disaster absolutely would be post-traumatic stress disorder, especially depending on what that person went through, what they saw, not only what happened to them individually, but what did they observe in other people. So nurses need to be involved in all stages of prevention and related activities, educate others about disasters, how to prepare and respond to them, and again, focusing in on what is a possible disaster in your area and get people to prepare for those. But no use preparing for an avalanche when that's not likely to happen in Sheboygan or Manitowoc. Keep up to date on the latest recommendations and advances in life-saving measures, and again, nurses need to maintain and carry an emergency kit. So questions nurses should ask: what kind of disasters threaten the communities where I live? What injuries should I expect from different disaster scenarios? What are the evacuation routes? Where are shelters located? What warning systems are used so I can respond effectively, personally and professionally during different types of disasters? And so now we're not talking about just public health nurses or community-based nurses. We're talking about all nurses. So you might think this just really relates to public health nursing or maybe nursing in an emergency room, because if you work in an emergency room, you are very likely to be dealing with the aftermath of an emergency. But truly, it's something that all nurses should think about. And again, one of the competencies of this learning plan is thinking about different types of partners that we have in disasters and different types of community resources. So Department of Homeland Security, FEMA, which is Federal Emergency Management Agency, Department of Health and Human Services, the CDC, Public Health Systems, American Red Cross, and there are other local, state, and federal agencies, but those are kind of some of the most common ones. So public health activities while search and rescue is going on, again, that's surveillance, so keeping that watchful eye for threats, contaminated water, vectors, and air quality. Public health is disseminating data on what's been found and relating that back to officials, the media, and the public as appropriate. Gather epidemiologic information and allocates resources to prevent further adverse health problems. And last but not least, we have to think about the recovery stage. The danger from the disaster has passed. All local, state, and federal agencies are present in the area, helping victims rebuild their lives, restoring public services, cleanup of damage and repair, evaluation and revision of disaster plans, and understanding the financial impact. So again, some of this really is following the nursing process, and think about that whole evaluation piece. So the little cartoon picture that I picked also just kind of, to me, shows that very graphically that we all need each other. Sometimes we might be falling off a mountain, we need some help. So accepting, having people, sometimes it's hard for people to learn to accept help, but having people accept help, and just the fact that we're all living in communities together and we all need to work together for the health and safety of our communities. So that is Learning Plan 12, and it has been an awesome sharing of all these 12 learning plans with all of you. So have a nice rest of the semester.